name is Godfrey Adede. We have three branches in Igo. We have Kawangware, Kibera and Kangemi. All of them, they offer family planning services. So we are hereby want to present to you Injectables, by which is the most common used method of family planning, and majority of the people of women in the country are using this kind of family planning. We have three types of injectables, and the first one is Depo-Provera, which is commonly used by women and it's known to everyone, by which you are injected at the upper arm. The second one is Sayana Press. Sayana Press was just introduced to Kenya like 2 or 3 years ago, and is being injected at your abdomen or thigh. It's most advised that this is the most beneficial type of injection, which is just like Depo, and a mother can be advised at least to go inject herself at home by given the guidelines and how to use it. So it's very beneficial to majority of women outside here. Then we have the Nuri Starata injection, which is usually given at the buttocks. So this kind of injection, they have progesterone, by which this progesterone is being released in your bloodstream, at least to prevent pregnancy occurring. The most common question is, how does it work? The progesterone levels being released, they prevent an ovulation in a woman. Then they can thicken the muscles of the cervix, by which it will make the cervix to be thick, and this will make difficulties of a sperm to penetrate in the womb. And lastly, it makes the lining of your uterine wall to be thinner, as well as to be thinner, so that the fertilized egg cannot work. How effective is this family planning? We say that it's 99% effective, whereby out of 100 women being injected a Depo, Sarana, Press or Nuristarat, out of 100, one will get pregnant, by which its effectiveness is 100%. Then you find that majority of these women, they might end up forgetting to come for return dates. When they don't come for return dates, chances of getting pregnancy is higher, which is 99.9%. Then after being administered this kind of injection, you need to give it at least 72 hours to be effective. So immediately you're being injected this kind of injection, you don't rush for sexual intercourse, because you might land up being pregnant. It's being discouraged to women below 18 years or women who have not given birth at all. We call them nari para. Reason being, these women, this kind of family planning, it interrupts your fertility levels. Therefore, the chances of getting pregnant, it will be difficult, and it can even cause fertility issues. Therefore, it's discouraged to women below 18 years or those who have not given birth. It can be used to postnatal women, by which we advise every postnatal woman who has just delivered with us, after 6 weeks, the moment this mother comes for immunization, for the first injection to this child, which is given at 6 weeks, zile za miguu, you find that at least this mother is advised to start this kind of family planning after making a choice, or the better choice of family planning. After miscarriage, a woman can be advised to use Depo-Provera or Sayana or this kind of injection immediately. Then who are not suitable people for this kind of injection? You find that if a woman thinks he or she is pregnant, she cannot use this kind of family planning. If you want to have a regular period, this kind of family planning is not encouraged. If you have heart diseases, stroke or high blood pressure, this kind of family planning is not encouraged. If you have obesity or overweight, this kind of family planning is not encouraged. If you have thrombocytosis, like a clot. You're being diagnosed with a clot. You cannot use this kind of family planning, or you have a liver disease, a breast cancer, or diabetes and liver cirrhosis. Liver disease, let me make it more clear to be liver disease. You cannot use this kind of family planning. We can talk about the advantages of using this kind of family planning. Number one, if you easily forget taking the family planning pills, this is the best kind of family planning to use. This kind of family planning prevents you from getting PID, that is pelvic inflammatory diseases, or having painful intercourse. It can solve your issues with this kind of family planning. It's very good. It's a good family planning for breastfeeding mothers because it doesn't interrupt the milk production, as well as it doesn't cause effects to the children. Let's talk about the complication or disadvantages of using this kind of family planning. If you have a disruption of periods, whereby your periods disrupt you, you have heavy bleeding or spotting, or any disruption in the periods, you cannot use it. It causes disruption of periods, whereby you can have no periods, or you have heavy menses or very light menses. Then it takes 3 to 1 year when you stop using this kind of family planning. It takes 3 to 1 year so that you can get pregnant. So if you are aspiring to have a child sooner, you cannot use this kind of family planning. If you have weight, you can have weight gain, headache, part of complication. You can have breast tenderness, by which you find that maybe you have painful breast, or your breast can be inflamed. Then you have changes in mood. You find that these mothers who are using family planning, maybe they can have those changes of mood, irritations. Then it causes loss of sex desire. You find that at least this person doesn't have any sexual desires. Then you find most of these people, these women who are using this kind of planning will have joint pain because of high progesterone levels in the bloodstream, which weakens the bones. So you find that they will have a lot of backache, joint pains, and all over the body. So it's advised that when you're using this kind of family planning, make a choice. Look at the disadvantages and advantages. So it's very important not to have unplanned pregnancy. We welcome Eagle Nursing Home clients to come and reach us on matters family planning. You can consult anywhere in Kawangware, Kibera, and Kangemi, which operates 24 hours. We have a program which is working in Kawangware, collaborating with Shofco, so that we can offer the family planning. We say family planning can begin at 9 years to up to a maximum of even 60 years, because we are preventing unwanted pregnancy. So we feel much welcome to be consulted and to be advised which is the best, so that you can make the best choice on family planning.